Welcome back to Your Health Matters. I'm Peggy Pico. It was certainly an attention-grabbing headline. Movie star Natasha Richardson struck down in the prime of her life after sustaining a head injury. But the reality is, it's an everyday occurrence for doctors at Eden Medical Trauma Center.
Here at Eden Medical Center, we see a large number of traumatic brain injuries, ranging from mild concussions to much more serious injuries that require surgery and other critical care interventions. We're fortunate that we have a team of physicians, technicians, nurses available 24 hours a day so that a patient who comes in has immediate access to anything that's required to treat a brain injury, whether it's something very mild or something more severe.
Like in the case of Dungchi Hyun.
I don't remember, but I hear my sister tell about it. So on the way go to work at 6:30, and I just caught the exit of freeway. So someone from the freeway come out and hit behind me. I just remember a little bit, just like when I fly up on the sky. So I tell myself this time I'm dead for sure.
When he arrived at the Eden Medical Trauma Center with a severe head injury, many wondered how he was even still alive.
When he came in, he was literally unconscious and could not breathe on his own. He was able to get immediately to the emergency room and then taken emergently into the operating room to be operated by the neurosurgeon to remove the large subdural hematoma. So that was like it's a big blood, he fell on his head. So basically, there's all this pressure that needed to be relieved from the excess blood that's accumulating in your brain.
Michelle Mitchell was part of the Neuroscience Center team that helped Hyun with his recovery. But even with the most extraordinary strides he has made, there's still a long road ahead of him. Like most traumatic head injuries, every success leads to a new challenge for the patient and his caregivers.
Doing activities of daily living, like brushing your teeth, getting dressed, eating, even simple as holding a fork. The nurses, of course, are here 24/7, and then the neurointensivist is managing the care, and then the neurosurgeons, and then the other disciplines, the trauma surgeons, and so it's a huge team approach.
According to Dr. Randall, any head injury should be taken seriously.
Anytime someone hits their head hard enough to have symptoms, that's potentially a significant injury. More than 1 million people have concussions or some sort of head injury in our country every year. Fortunately, most of those are mild and people recover fully. However, a small percentage can progress to become more of a serious problem, and that's why the availability of prompt medical attention is very, very important.
Of course, accidents happen. It's just a fact of life. But for the most part, there are things you can do to actually prevent these types of injury and protect yourself from head trauma.
The keys are avoiding behavior that is more likely to put one at risk for head injury, and that we tend to think just of teenagers who drive too fast or drink too much, but the same applies to older patients, older people who are driving in the rain too fast, or older people who are cleaning the gutters when perhaps they shouldn't and put themselves at increased risk for fall. So that message of avoiding riskier behavior is one that we can all listen to.
Wearing a helmet is perhaps the easiest thing you can do to protect yourself from head trauma injury. And I wanted to ask you, Dr. Snyder, have you noticed a difference since helmets have become more popular, since there's been more enforcement of helmet laws?
Yes, Peggy, head trauma is still quite common, but the severity, the severely injured individual is not so severely injured if they wear a helmet. And the important thing is to wear the helmet all the time, not just some of the time.
So bike riding, skating,
Bike riding is probably the most important. Probably the number one cause of head injury is actually from bicycle riding. And so wearing your bicycle helmet all the time is the most important thing.
Right, there's a lot of factors there that you can't control, cars and other things like that. What are the symptoms of a head trauma versus just, I bumped my head and I got a bruise? What's an actual, where it might be dangerous?
Well, I think you're going to know there's head trauma that might be serious. Anytime you see a change in someone's level of consciousness, their level of awareness, if they've got nausea and vomiting, these types of things, that's an immediate attention grabber. They start vomiting, they start saying words, they seem confused. That type of a change in consciousness should alert you that there's something going on, needs to be investigated.
Mm-hmm. And what if you don't see blood? I mean, you always see in the movies, right? Yeah, you hit your head and blood's coming out of the nose or ears. Is that necessarily a sign, or, go with the unconsciousness and the other things, or, vomiting or things like that?
It's certainly not necessarily a sign. It's an obvious sign, and one that anyone can pick up on. But there may be internal injuries, injuries that you can't see, injuries that don't involve blood, can be just as life-threatening, and those injuries need to be treated immediately.
As we saw, with the skiing accident, is there a delay? Sometimes you can have a delay in a head trauma, like you get hurt, you land on your head, and then the effect doesn't happen for a couple hours later. Is that correct?
And that's exactly correct. It's known as the lucid interval. There's some period of time where things may seem normal shortly after the accident. There may have been a very brief change in their consciousness, and then there's some period of time where things seem normal. That's the lucid interval. That's the time where you may be deceived. Things may be okay. They're really not. You need to be evaluated.
Okay, and just come in better safe than sorry and get checked out on that. The last thing is, when, let's say, somebody falls and they hit their head, is it important to rush them? Should we get them in the car? Should we call, again, 911? Or, how important is it to call an ambulance versus driving them there yourself?
I think it's essential. If you have 911 facilities close by, that's the most important way to transport an individual, especially with a head injury. If they start having changes en route, they have the materials in the back of their ambulance. They can try to stabilize that patient until he gets to the hospital, and we can take care of him.
Yeah, again, that golden hour, talking about the time on that.
The clock's ticking.
It is absolutely ticking. Now, keeping yourself out of the trauma center goes way beyond helmets, of course. When we come back, how Eden Medical Center is helping stop trauma before it happens right in our own community.